MCDC was really started for adults who had Medicaid but didn't have true access to care. So our mission is that we seek to enhance the overall health of the community by offering access to quality dental care for all. We believe that everyone should have access to good oral health care. We believe it should be of the highest quality. We don't think that there should be any disparities between those that have health insurance and those that don't have health insurance, or people that have state-funded insurance. So really, overall, what we seek to do is to make each community that we have a presence in, we seek to make them healthy and to make sure that they have access to care.
When I reflect on the history of my community dental centers, we've been committed to providing quality access to dental care for all for over 18 years. We were established in 2006. We are currently one of Michigan's largest nonprofit dental support organizations, providing care to underserved, being low income and Medicaid. That's our focal point. We have 34 centers that operate throughout the state of Michigan, many of them in rural and urban areas. And on an annual basis, we serve over 97,000 unique patients per year. A really super unique thing about MCDC is that we are a safety net dental provider, and all of our centers are operated in partnership with local health departments. This model has enabled us to receive an enhanced reimbursement rate for serving adults enrolled in Medicaid.
So I think those words of describing our culture is dynamic, evolving, responsive, and engaged.
We have an exemplifying excellence document. That is our framework for culture today. But we didn't have it, and we needed to talk about culture in a way that it was so important we couldn't get to sustainability without it. So we have 4 tenets that we stick by. It starts with integrity, teamwork, stewardship, and compassion. Every decision we make, we look to filter that through that document. Does it exemplify excellence? Is this going to get us to where we need to be?
We recognize that culture drives our ability to attract employees, our employees' decision to stay with the organization, and ultimately our patient experience.
Providing clinical patient care isn't just about what you do in the mouth. It's about caring for the whole patient.
Providing great clinical care to me looks like providers that are engaged and actively listening to our patients. Every patient has unique needs, circumstances, and there aren't situations where it's one size fits all. Having our providers actively paying attention, addressing the individual needs, and doing it in a responsible and compassionate way is truly the path forward for success, not only as an organization, but long-term success for patient outcomes.
But when it comes to great clinical patient care, I want our providers to treatment plan as they see fit. All right, you treatment plan, you do the best with that. We're going to handle the business side. Don't stress about the money piece. Don't stress about any of the human resource piece. You have your patient. We're here to support you. If it's a product that you need that's going to help streamline the service or improve that care, I want to talk about it. I know the rest of the team wants to talk about it, and we're going to work on getting that. Ultimately, it might end up on our formulary someday. But the big thing is giving our providers the autonomy to see their patients as they see fit. And it's not a top-down approach. And we do a lot with them, coaching and supporting, whether it be through continuing education or just educating them on some communication and support in the practice.
Clinical care or oral health care is about much more than just doing a filling or extracting a tooth or making a denture.
The main focus behind the formulary is to have quality products and competitive pricing. That's where we rely on Patterson to go to bat for us. Pricing is very important. We select the top 3, 4, 5 brands that we deal with, even if they're perhaps a little bit higher in some specific areas, like maybe restorative dentistry. It might be worth paying a little more for that particular item because as a whole, we're using them a larger percentage of the time So as a whole, we're getting a really, really good price discount from Patterson so that they can pass it through to us.
Utilizing a merchandise formulary allows us opportunities to control which items are being utilized within the organization with input from our providers. We have a team internally that vets products that we are proposing to add. So none of these decisions are made in a vacuum. We are participating with our providers to ensure that we are providing quality tools and products to them to help them operate, but also controlling expenses on our side by making sure that we are choosing quality products at a good price point.
We do have a report every month from Patterson Dental, and they give us a monthly report where we can see the non-formulary items that have been purchased from the specific centers, and we're able to go in there and look at those centers that are off formulary at a higher percentage, and then we can go in and coach to using those formulary products as an alternative. So, and that works very well. That's how we kind of keep the formulary in order and keep the compliance there.
I think what the future looks like for us is more efficiency in what we do so that we can bring services to a greater number of patients. It looks like innovation, because we know that the dental industry is changing rapidly. We're seeing artificial intelligence. We're seeing much more implants being placed rather than doing bridges and cutting people's natural teeth down. We're seeing scanning technology so that people can get their crowns and dentures much quicker. So MCDC wants to be a part of that innovation, because we feel that just because you're underserved or you have Medicaid, you should be able to access those same innovations that are being seen in corporate dentistry or in private practices. When you affect one person, that in turn gives something back to you. So from an individualistic point of view, our employees work hard every day, and we know that it can be very stressful. But bringing that one smile to a patient empowers them to keep going. It re-energizes them. And therefore, when our employees feel good about what they're doing, good about bringing a smile to each individual person, they bring that back to the organization, and they feed us as leaders so that we can then support them. So it's full circle for us, I believe, at MCDC when we say that we're improving lives one smile at a time, because we really are. We see and feel what's happening in the communities by each patient. We'll get stories back from some of our team members, how a patient sent them flowers or brought in candy for them because they are so happy with their smile. And so that means a lot. And it keeps the organization fueled from knowing that we do that in the community.